Hi, this is Mayor David Genshaw, and I'm here today with Corey Miklus from our Seaford School District and Penny Short from TidalHealth Nanticoke. And we had such good responses the last time we were pushing information out together. We thought we would bring you an update on what's going on in each of our organizations. So, Corey, I'll ask you to lead off with what's going on at the Seaford School District.
All right. Well, last week was very exciting for the Seaford School District. We welcomed back our staff and also our new teachers to the district. This coming week will be our start of school for our students. So on Wednesday, August 24th, our pre-K, kindergarten, 3rd grade, 6th grade, and 9th graders will attend school. And on Thursday, August 25th, all of our students will be attending school. We also have some big updates that we want to share with the community. And a lot of it focuses around safety and security. So when you enter our schools now, each school has something called a visitor management system where adults will need to show a license to be able to enter our school. And again, this is for safety and security. We also have addressed some of our parking and traffic concerns at our Seaford Middle School and Seaford High School. So the lot next to the football stadium will now be student parking. And the lot behind the Seaford High School will be where the parents drop off and pick up. You also will see some new curb markings, yellow lines indicating no parking. Also on School Lane, you will see a drop-off area marked in blue to make sure that traffic flow keeps going there. Another area I want to highlight was this year, we'll be developing a wellness center at Fred Douglass Elementary School, and this will help the community and our families with much needed medical care. And that's my updates.
Okay, thank you very much. The changes that you're going to see around traffic at the schools, the city of Seaford will be putting up signs, the police will be out there helping as well, as long as a lot of teachers. But if you've ever been by the schools at bus let-out time, you know it's been very challenging. These are some first steps in trying to improve that. So I think you'll see continued improvements going into the future, but right now this is the first shot at it. So, but it will be a change and there'll be more communication coming out on that. So thank you, Corey. Penny, would you like to update us on the hospital?
Sure. I thought I'd start first with an update on COVID. If you've watched the news, you know, with the positivity rate within Delaware has sort of been up and down over the summer. There has been we've noticed an increase in patients coming to the emergency room that are testing positive. But the good thing is most of them are cold or flu-like symptoms, and they're able to care for themselves at home. But we have seen an increase also in some hospitalizations. Good news is they're not critical care type patients, but they're patients that have other underlying conditions that then contracting COVID does provide them a higher level of illness and need to be watched a little bit closer. So I think what I'd like to say is if you do have underlying conditions, still be cautious and careful when you're out there in large groups because it does seem that that's the group that seems to get sicker from COVID. Couple exciting things that are happening, and one that I'm really anxious to get started, and that is that we have received federal, state, and Sussex County grants to provide a wellness mobile health van that will be out in our communities, mainly in ones that do have trouble accessing care. We're in the process right now of hiring a nurse practitioner, a registered nurse, and a community health worker that will be out there, and the van will be outfitted to be able to provide a wellness visit as well as those important screenings that many times are omitted because of access. So we're excited to get that out and look for the van out and about in the next month or so. A couple other things that have started since in the last year and a half since we've met, and that is we have been very fortunate to start a robotic surgery program. We have Dr. Kurt Weber, who's a cardiovascular surgeon with a lot of robotic experience that's joined our team, and he has put together a lung cancer program that really is identified to diagnose early and be able to treat. And with the robotic surgery, it's less invasive, better recovery, and better outcomes. So we're very excited for the work he's doing there. Dr. Bazaliski has joined that team, and he is a general surgeon, and he's doing robotic gallbladders, hernias, and colon surgery, and just started bariatrics as well. So he has a couple surgeons joining him in the next month. So that robotic area is certainly a growth and has been a growth for us. One thing that I thought would be important to mention is obstetrics, because I know there's been a lot of concern in the community and people asking, is at TidalHealth Nanticoke, are we still delivering babies? And yes, we are. We've certainly been through some hurdles, but we have changed our model, which is the model that most of the other hospitals are using within Sussex County, and that is to partner with another organization, and that's Team Health for us, and they actually provide us with board certified GYN and OB physicians that are in the hospital 24/7 to be there to deliver the babies. And then that allows us the opportunity to recruit aggressively to support the office to take care of those people that are delivering babies. So more to come on that. I think we'll see in the near future some more obstetrics in the community. Challenges for us, like many other businesses, has been workforce. And so we really have tried to be as creative as possible, really working with the schools and the colleges to try to get the interest in the healthcare profession. But we've also worked to enhance our tuition reimbursement and provide grants. So we like to say we want people to start with us and grow with us so that you can enter in an entry-level position, and then we'll work with you financially to support your healthcare career and get you to those end goals. So I think that's our update.
That is really good. Again, we're very fortunate here in Seaford that our school district and our hospital, we all work very closely together, keeping us up to date. And I think these updates are important. As you know, at the city, we're seeing just a time of incredible revitalization. The office we're sitting at right now, we're overlooking Gateway Park, and we're wrapping up that project now, which is just going to improve the walkability to downtown and beautify our city. So lots of good things going on, but we always want to hear from you. We'll put up here on the screen some contacts for both the school district and the hospital, as well as the city. If you have any questions you would like us to address, we would certainly love to hear from you. Again, we'll follow up as soon as we hear from you on those things. But again, thank you for listening, and God bless.